Hi, I'm Nick the nurse. Today we're going to be talking about bone marrow transplants. Now, when you're taking nursing school exams or you're studying for the NCLEX or you're actually in your clinical nursing practice, there are several things that you need to remember about bone marrow transplants as they relate to nursing. First and foremost, bone marrow transplants can be indicated for a patient who might have leukemia, aplastic anemia, or other associated immunocompromised states. Additionally, they might be used for patients who are undergoing large doses of chemotherapy, because remember that when a patient who has cancer or some other type of disease in that kind of family, the chemotherapy not only often attacks the bad cells, but it also attacks the good cells. So that can lead to bone marrow suppression, and sometimes bone marrow transplantation can be given to help stimulate the production of new bone marrow. Additionally, as a good nursing student, you know that it's extremely important to make sure that the donor who's providing the bone marrow is matched with the person who's going to be receiving the bone marrow. This prevents bad reactions that occur in the patient. It prevents graft versus host disease and a whole other slew of things that could go wrong. You want to make sure that you have a donor who is matched with the recipient. You also want to make sure that the patient who's about to receive a bone marrow transplant is replaced on reverse isolation or neutropenic precautions. We do this because the patient who's going to be receiving a bone marrow transplant is most likely immunocompromised to begin with, and certainly will be at a higher risk for infection after going a bone marrow transplant because the body is in flux and trying to produce more marrow. So we want to give our patient who's undergoing a bone marrow transplant the greatest possible chance that they're going to have a successful transplant. So we want to make sure that we keep them free from disease and free from infection. And last but not least, immunosuppressant drugs are often given after a bone marrow transplant in order to prevent graft versus host disease and other possible complications that might arise. Again, these are some of the things that might come up on your NCLEX or nursing school exams. This is not meant to be clinical advice to be used in the clinical setting. And I'm Nick the nurse, and we'll see you next time.